Okay, so hi, how are you doing?
I'm good. How are you?
Good. So my name is Karina Garza, and I am going to be performing a biopsychosocial assessment with you today. And basically, we're going to just be discussing your biological, social, and psychological factors. This assessment is going to take 30 to 40 minutes. Are you comfortable with being recorded right now?
Ma'am.
Okay. So I kind of want to do a little introduction, and if you don't mind telling me your name, age, and your cultural background, and also giving me a little like, summary as to why you are here today. Why are you wanting services?
So my name is Jacob Jerez. I'm 24. I will be 25 in about a couple weeks.
Okay.
Born here in the States, but my entire family is from Dominican Republic. So I
Mhm.
do have Hispanic culture behind me.
Okay.
Um, I'm here today really to kind of talk about my childhood growing up in a Hispanic household and how that has changed my outlook on life and stuff and how it kind of made me the adult I am today.
Okay, and we can definitely talk about that. Um, so what sort of, let's actually start with like your medical history. Have you ever been hospitalized? Have you ever had any surgeries?
I had my tonsils removed when I was 9 months old due
Hmm.
to being able to swallow any food that my mom was giving me, milk at the time, obviously.
Hmm.
And what my mom has told me after that, it took me a while to like form words in a way. Once
Hmm.
I age where I was able to speak, she thinks that it had an effect on my speech, so she did enroll me in speech therapy.
Hmm.
And now she tells me now I can't shut my mouth.
That's so funny. So you had some sort of like delay when at a young age with speech. Okay.
Mhm.
Were you ever like enrolled in like speech therapies?
From what I can remember, yes, and like what my mom tells me, yes, I was for a few months, not too long,
Hmm.
but a month, yeah, from what I can remember.
Okay. But that was kind of like the only surgery that you've ever had was your getting your tonsils removed?
Yeah.
Okay. Have aside from that, were you taking any like medications during that time? Or are you currently taking any sort of medications?
As of right now, no, I'm on no medications, but whatever the doctor prescribed for my healing process at the time, I'm sure my mom felicitated to me. Yeah.
Okay. Do you have currently any deal with any substance abuse? Like do you have like a history with like alcohol or any other drug?
I when I was a little bit younger, my early teen years, I was big on marijuana, but as I
Mhm.
faded towards it, and once I hit drinking age, I'll drink, but I'm more of a social drinker, and I vape mostly.
So how long were you kind of going through this time where you were using marijuana?
I would say about a year and a half. It was really after my first ever break. I was a teen. I didn't really know what like how to deal with it, and at the time
Mhm.
around the wrong crowd, and I
Mhm.
realized that weed kind of numbed the emotions for me.
Mhm.
I feel like really my sophomore to my junior year was really at my peak of marijuana use.
Okay. I just wanted to let you know that marijuana is illegal in the state of Tennessee, unless you are prescribed by a doctor to use it for any medical reason. But you said that you were using it when you were in high school, so I'm assuming that you don't use it now.
Man.
Okay. So let's move on to the next topic, mental health history. What do you have like a diagnosis? Like are you
Um,
currently suffering from like depression, anxiety, or any other medical health issue?
I haven't been diagnosed of anything, but I guess I can self-diagnose myself. I do deal with anxiety sometimes, especially like
Mhm.
when something doesn't go my way. I guess you could say like I usually
Mhm.
plan my out and expect things to happen. And when that thing doesn't happen, it kind of throws me off completely, and I just get anxious and like kind of shut down and just
Mhm.
avoid it completely. And then if that does happen, I don't feel motivated or like what's the word I'm looking for? Determined to do anything else for the rest of the day if that one thing goes wrong, you know?
And do you think that you deal with anxiety like on the day to day, or is it like when you are you like enrolled in school or anything?
No, I want to go back to school, but not currently.
Okay, so when you were in school, did your anxiety occur like a lot during that time or
I feel like it did, yes, because I had graduated high school in 2019 and I went back
Mhm.
in 2024. So it was a long break between education and all that stuff.
Mhm.
But back to school was definitely nerve wracking and anxiety filled because of timelines and due dates. But
Mhm.
as the semester went on, it kind of got a little bit better because I was more on track with it. But then toward the end of my school career, I guess you want to say, um, it got pretty bad again because of all the final grades and all the tests and all that stuff.
Mhm. Okay. So you the will say that the only mental health history is that you kind of self-diagnosed yourself for having anxiety,
Yes,
but you
ma'am.
haven't been diagnosed by any therapist or doctor. Okay.
I've I've seen a therapist when I was younger, but that was after a breakup and it was only one session, so it wasn't
Mhm.
like I never continued followed up on it really.
Mhm.
I have not prescribed, diagnosed with anything.
How long ago was that when you were receiving that one session that you had?
2018. So
Okay, and that was kind of like the last time that you've ever gone to therapy?
mhm.
Okay. Um, your emotional state. Let's talk about that. What is your like a current like emotional well-being right now?
I would say I'm pretty happy with my life.
Mhm.
I'm obviously things could be better and different, but
Mhm.
state and emotional state right now, I feel like we're on the same level. There's not one pulling more than the other, you know.
Mhm.
I would feel like I'm okay, I'm happy, I'm content.
Okay.
Mhm.
That's good to hear.
Mhm.
Um, for since you self-diagnosed yourself for anxiety, what sort of coping strategies do you tend to use when you're having those days where your anxiety is like hitting you, let's say higher than it normally does? Like, what sort of coping skills do you tend to use on those sort of days?
Mostly I like to stick to video games where it's
Mhm.
like when I'm playing video games, I feel like I'm in the world, whatever game I'm playing. And
Mhm.
I play with my friends most of the time, so I'm not alone. And I feel like that is a really good coping mechanism for me. And
Mhm.
playing video games, I try to be social in other aspects, whether that
Mhm.
be texting old friends or catching up with family. I just try to keep myself talking, I guess you want to say, so I
Mhm.
don't much time to myself and in my head and all that stuff, you know?
Okay. So you said that video games is kind of like the main one that you tend to use to help with your anxiety, like a coping mechanism. Sorry. So how long would you say that you tend to be like on the game for to help with like anxiety? I see
Hon-
that face that you just made, so I'm wondering, I'm pretty sure it's long.
Honestly, I consider it my 9 to 5 after my 9 to 5. So
Okay.
once I get home from work, it's usually the first thing I'm doing.
Mhm.
If I have a bunch of free time, really all my free time is spent on the video games.
Mhm.
If I'm out in a social setting, I'm usually with my friends, probably thinking about playing video games. But
Mhm.
yeah, I would say a lot of my days is filled with video games.
Okay. I definitely recommend, I mean, that is one of your best coping mechanisms that you tend to use, but I would definitely recommend for you maybe trying like out other sort of coping mechanisms. Have you ever thought about like enrolling in like any sports, like group where you get to be with like groups of people or like doing maybe some breathing techniques to help with you during those times?
Definitely, right now it's kind of hard because I don't have a car and living
Mhm.
in living is very car friendly, not car friendly,
Mhm.
like car dependent, you know.
Mhm.
So it's been kind of tough on me, but thankfully that later this week I will be getting a car. So
Oh,
definitely
that's good.
I'm definitely gonna explore what more to do, so I'm not at home
Mhm.
as much as I am now. But yeah, I'm
Mhm.
definitely looking into like the YMCA. I definitely want to go to the gym and like work on myself because I feel like
Mhm. That's good.
I don't struggle with body like what I'm saying.
Image.
Yeah, sometimes it
Mhm.
can be like on the days that I'm down, that plays a part in it too. So
Mhm.
definitely is something I'm looking forward to signing up for and building a routine with that.
That's really good. How long, you said you mentioned that you haven't had a car, so it's been a little bit of a struggle for you to be able to do this sort of activity, going to the YMCA and signing up to do sporting activities. How long have you been without a car?
Honestly, I would say almost 6 months now. Then
Mhm.
early August is when
Mhm. Do you think that also has been kind of playing a part in your anxiety as of lately, these past 6 months?
it definitely has. But like I said, us living in a car dependent city,
Mhm.
and I'm stuck at home all day really. So that's why
Mhm.
they're a big factor in it too because I have nowhere to go. So I
Mhm.
spend all my time at home. And when I do go out, it's a lot of money because I'm taking like ride sharing apps or I'm asking
Mhm.
for rides and I'm paying them back for gas money and all that stuff. So yeah,
Mhm.
that's a big part into my anxiety.
Okay. Let's move on. Personality factors. Do you tend to have let's say like bad thoughts in your head during at this time since you've been dealing with like the anxiety of not having a car and also not being able to do other activities that you've been wanting to do?
Mm. I wouldn't necessarily say bad thoughts, like no thoughts of
Mhm.
anything like that. But I mean, there's been thoughts where like I feel like I let a lot of people down,
Mhm.
because at the age I'm at, especially how I grew up, a lot of
Mhm.
people my age are kind of set, and some
Mhm.
like not having a car set me back in a life turn.
Mhm.
But yeah, it's been hard.
Okay. Um Let's talk about your trauma history. So I know that you were saying how you kind of grew up in like a Hispanic cultural background. How do you think that what sort of trauma have you been dealing with around that? But also, how do you think that may be like affecting you now in your like day to day?
I would say I grew up with a single mother. I am the
Mhm.
youngest. My dad, from what I know, my dad had abandoned my family at a very young age after I was born.
Mhm.
And also my brother and my sister had different fathers, so we all have the
Mhm.
same fathers. But my mother raised all three of us in a happy home. I would feel like there's some challenging times because my sister's 10 years older than me and my brother's 7 years older than me.
Mhm.
That was really difficult because they were already grown by the time I was, growing up and like discovering things.
Mhm.
And I feel like that kind of forced me to be more outgoing and social.
Mhm.
Like my siblings are in the same age group as me.
Mhm.
It was hard at times because when there was trouble at home, it'd be mostly me and my mother. So like I didn't really, and my mother kept a lot from me as a kid since I was the youngest. So I like looking back, I can see why she hid a lot from me, but it was like more so like just I felt helpless really because when I was in middle school, my mom had been diagnosed with breast cancer.
Mhm.
She didn't tell me, but my brother and sister knew. And when I remember vaguely, I was in the kitchen and I could hear them crying.
Mhm.
But luckily enough, it was discovered like very early, so she was able to get a procedure done and clear of it. But
Mhm.
that had played a big part on me, like not secretive, but like I get my mom wanted to protect me from all that stuff, but I also felt like shut out.
Yes.
A lot of the time, and I feel like that's where my video game addiction like started. Really, was because it was just me. I would play outside at a very young age, but once I hit like the preteen years, and like it was really just staying in my room playing video games, like shut out from the world, you know?
Mhm. So video games play an important part for you because in a way it was kind of like isolating you from all of the problems that were going on in your life.
Mhm.
How long during let's when your mom was dealing with breast cancer, what year was this?
I would say like elementary school, fifth, sixth grade. And I remember that because I was going to a private Catholic school at the time. And every
Mhm.
morning, prayer circle. And I remember like raising my hand and like asking my friends and classmates to pray for my mom. And I remember breaking down crying that day because it was very
Mhm.
emotional and it was very hard. And also a few weeks after she got it all removed, we had gotten into a car accident
Mhm.
pretty close by. Like she was still in stitches and all of that. So and then a part of me. So what happened was we had gone out for food and I had requested the food. So me and my mom had went and then at the restaurant we got into the car accident and a lot that played a part in me because I felt like it was my fault and I was
Mhm.
really about my mother. But everything turned out fine. We were all good
Mhm.
in at the end of the day, yeah.
Okay. So do you still hold that sort of resentment over it kind of being you thinking that this was your fault that you guys had this accident?
A part of me, yes, because as I got to the age where I got my license very late because that car accident really had an effect on me driving and all that stuff.
Mhm.
I didn't really get my license until I was almost 20 years old. So
Mhm.
like that definitely played a part in it because it was just very traumatic at the moment. You know, it was like that was the first time I've ever been in an ambulance and like I got
Mhm.
strapped and that stuff. So that was very scary for me. Yeah, but like not as much now. I prefer not to travel long distances alone because of that as well, you know.
Mhm.
But I wouldn't say it takes a big part of my life, but sometimes.
Okay. So how since this was back when you were younger, when you were in elementary school, how is your current relationship with your family members?
I would say it's a lot better than it was before because now we're all grown adults, you know, and we all have. I've experienced what they were experiencing at the time, you know. So like now it brought us closer, I would say, because
Mhm.
we're all spread out right now, but a lots of times we try to plan to like meet each other for like Thanksgiving and Christmas and all that stuff.
Mhm.
We like in terms of my siblings, I feel like that built us closer since there was a big an age gap. I feel like when my sister had kids, that really brought us all together.
Mhm.
She had moved back into with my mom at the time, so we were just all like helping her raise my niece. And over time, yeah, I feel like my sister having kids and us getting older really brought us together.
That's good to hear. Um, with you guys now having a better relationship, did you discuss these just not finding out, not knowing at a young age that your mom had breast cancer and then keeping it from you? Did you let them express your feelings towards that with them now that you're older?
I feel like that played a part into my Hispanic household. I feel like
Mhm.
growing up in a Hispanic household, very I wasn't a victim of it or whatever, but from what I see from friends and stuff, I feel like a lot of things like that don't get talked about within that community because of how bad it seems. You know what I'm saying?
Mhm.
Like I know my brother dealt with depression a little bit in high school, but it wasn't really talked about because kind of the mindset Hispanics have is you have a house, you have food and all that. What there to be depressed about, you know?
Mhm.
That was a big thing. So not really not talked about now. Even now, we don't really talk about our personal feelings, I guess you could say.
Mhm.
That's just more of just like we grew up that way. It's always just how it's been my whole life. So I feel like talking to my family about personal things is hard, yes. But like if I'm in a situation where I don't know what to do next, I would definitely contact my family. But
Mhm.
if it's more on a personal level, I try to seek out friends who are like
Mhm.
my understanding, you know.
Mhm.
But no, I feel like yeah, like back to the Hispanic thing, it's frowned upon, I guess you want to say. So it's very hard to I guess, try to talk to my family about that kind of like within the family, you know.
Mhm.
Outside of the family, it's a lot easier because we're not dealing with it. But yeah, it's definitely we are close, but it's not close enough, if you want to call it that, you know.
Okay. So basically in your household, it was kind of hard to be able to express any like concerns or your feelings over anything. Um, I understand that. As far as you not being able to kind of express your feelings with your family members, do you try to lean more towards your friends when it comes to certain issues that are going on in your life?
Definitely yes, because back to the Hispanic thing, like it's more of a be a man mentality, and it's kind of hard to have that mentality when you were raised by a single mother, and my
Mhm.
brother so much older, it was kind of hard for him to be at home too, because he was dealing with his own stuff and he was doing
Mhm.
stuff. So really, it was just me and my mom. And like I guess once my brother moved out, I was the man of the house, really. But still, it was like I was still going with my own thing with the breakup and stuff. It was hard to go to my mom about that because of the
Mhm.
be a man mentality. So yeah, I definitely seek my friends out more because a lot of my friends aren't part of the Hispanic community.
Mhm.
So I can not relate to them, but I can vent to them and them not have the same like be a man mindset or like there's nothing to be depressed about. I feel like they are
Mhm.
than when it comes to like a Hispanic family or just really family in general.
Mhm. Okay. Um, so let me see. You you don't tend to vent, don't tend to discuss your problems with your Hispanic family, but you do tend to lean more towards your friends who are non-Hispanic. Um, how would you say they tend to perceive you? Like, what is their idea of you?
I I haven't been told what people, my friends don't tell me what they think of me, but
Mhm.
they could see why I am who I am, what I'm saying? Why I am who I am, because
Mhm.
I don't tell them a lot about my family, but like the parts I have told them, it's very easy to pick up. I go from there, you know what I'm saying? So it's like,
Mhm.
well, yeah, you're locked in your room all day because your mom shut you out in a way, you know what I'm saying?
Mhm.
So, but I try not to go too deep into it because it's kind of my personal business.
Mhm.
And really, when I go to seek my friends, it's just more of like how they would react to it.
Mhm.
Like my mom would take my video games away from me. At the time, it wasn't a big deal. When I was younger, I made it a big deal.
Mhm.
But back at it, it wasn't a big deal. But I feel like my friends could perceive me as content. I guess you could say. I feel like there's no worry where my friends worry about me.
Mhm. I know you mentioned how your mom was diagnosed with breast cancer. Is there any like other like family history of like illness? Does like your brother or your sisters have any illness?
Not again, like we don't really talk about this, so not that I would know.
Mhm.
My grandmother had passed away in 2020 from a stroke.
Mhm.
Think it was COVID like involved, but she had died from a stroke and she had early onset dementia. That's what I
Mhm.
know. But like my mom, my brother, sister, no, none of that.
Okay. Do you have any illness that you know of?
Not that I know of. No,
Okay. Are you currently seeing a doctor?
no, I am not. I right now the resources aren't available. I do have insurance with my job, but
Mhm.
it takes a lot. I still haven't built up. Like again, I don't have a car, so it's kind of hard for me to go and see a doctor.
Mhm.
Definitely get a car. It's something on my list, and not
Mhm.
only also a therapist because I feel like I'm content, but I feel like I need someone to talk to about it.
Mhm. So you don't have a car, but do you have a home? Are
Mhm.
you renting? Or do you have do you have a personal home of your own, like a house, or are you renting like in an apartment?
Yes, ma'am. I'm renting a one-bedroom apartment right now.
Okay. Do you feel like you're safe in the area?
Oh, yeah, definitely. I was talking about it with my friend yesterday, actually, at Thanksgiving dinner. It's pretty quiet. I have no
Mhm.
My neighbors are cool, chill. I
Mhm.
talk to everyone else sees them, but no complaints really.
Okay. Um, the area that you're living in right now, are you currently dealing with any, like, financial issues?
I would say yes. I feel like I'm just keeping afloat. I'm living check to check. Definitely, like my work pays me well enough where I can cover all my bills and stuff.
Mhm.
But after all my bills, I have no money. I guess you could say for my own personal expenses.
Mhm.
So I feel like I struggle with that a lot. And me having a kid back in June really plays a
Mhm.
part too because I would say a lot of my money is going towards them.
Mhm.
And that's a bad thing, but I feel like I don't have enough money for myself. So that's why I feel like it plays a part into my video game, where it's just like
Mhm.
I'm at home, I'm not spending any money. So I feel like that
So,
factor into me, yeah.
okay, so all of your basically your paychecks are going to either expenses or your child.
Mm.
Um, since you did mention that you have a child, are you and your partner living together, or are you both living in separate areas? How's kind of that dynamic?
Currently, we are together, but we do not live together currently. She lives
Mhm.
over her family and the baby
Mhm.
um, with them throughout her pregnancy, but I decided to move back to Tennessee for work reasons.
Mhm.
I feel like that plays a part in my anxiety as well, just not being
Mhm.
able to baby and her. But I still talk to them like over FaceTime and stuff, and I still see the baby. So that makes it better, but not 100% better.
Mhm. Since you are kind of dealing with some sort of financial issues, obviously not having a car also has to play a factor too. Because you're probably trying to save up your money in order to get a vehicle. Um, are you planning on coming up with any once you do end up getting a vehicle? I think you said by Friday. This Friday or next Friday?
This Friday, not
Okay.
today. I guess the next Friday, yeah.
Okay. Um, are you planning on possibly getting a second job or maybe asking for more hours at the job that you currently have?
Definitely a second job is on my mind because my first job takes up most of my days. I'm there from 8 to 3:30.
Mhm.
I feel like that pays me well enough where I don't have to get another second job to work that many hours.
Mhm.
So looking for a part time to do after my first job. And once I feel I get that part time, definitely financially, I would be a lot in a better headspace financially with a second job.
Okay. Um, I don't know if we discussed this, but what is your first job that you're currently working at?
I provide therapy with kids that have autism. I'm a registered
Mhm.
pediatrician, and what that looks like day to day, really, I'm one on one with my client. I provide therapy in the sense of social play, like
Mhm.
helping them play around peers and how to properly play with toys and all that stuff.
Mhm. Do you think that job has to be pretty hard at times? Do you think that that job may also play a part into your anxiety?
In the sense of me just having a baby not that long ago, I like struggle with it because I'm over here working with kids that aren't mine essentially, while
Mhm.
I'm at home. And I feel like that played a big part. Other than that, no, not really. I feel like every day is something new when I walk into work, and I'm very optimistic about walking into work, I would say, because, like I said, something new. Essentially, I'm getting paid to have fun with these kids, so like I feel like that plays a big part in me not. I feel like when I go to work, I'm a lot stress free because
Mhm.
the workers and the people I have around me and like the job I do, it's very.
Okay. That's good to hear. What is your, I know you said that you are a registered behavioral technician. Did you need any sort of education background for that, or what is your education level as of right now?
As of right now, I have a high school diploma. I've completed a semester of psychology at Chattanooga State
Mhm.
about a year ago now. Um, High school, academic wise, was really good at first, and then once I got older, like my junior senior year, I kind of let my grades slip a little bit,
Mhm.
and I feel like that's a me. That was a me thing, because I was going through that age. I was becoming an adult, so like I was focusing on other things at the time.
Mhm.
But it took me a while to re-enroll into school, and I went back to psychology for the job that I'm working now.
Mhm.
No, I mean just a couple. We did a 40-hour training course for the
Mhm.
job, and I did my competency more than one time. I will admit, it was very hard because it was something new I was learning. But once I got the
Mhm.
hang, I passed my RBT exam, and then when I moved to Michigan and I moved back to Tennessee, I came back to the same job where I'm at now. And I feel like since I had that experience, it definitely was a lot easier the second time around.
Mhm.
And now, the longer I am at that job, I do want to go back to school for that job. So I'm definitely looking into that.
Okay, that's good to hear.
Mhm.
I would definitely recommend it, especially with the career that you have right now. That would definitely help. Do you have any like legal history? Like, does this job do like a background check?
They do a background check, yes, and it came out clear. I have never been arrested, no tickets, none of that.
Okay, that's good to hear. Let's see. Do you have like a cultural background? Like, are you attending church or anything like that?
At the moment, no. I would like to attend church just to
Mhm.
be my religion, I guess you want to say. But
Mhm.
I didn't grow up in an atheist household, but religion was not practiced in my house.
Mhm.
And like a lot of when I grew up, it wasn't preached. It wasn't like forced on me, or I guess you could say. Me going to a Catholic school in fifth grade wasn't for religious reason. It was just because my brother had also gone to the school, and it was a really good private school.
Mhm.
Um, but no, I wouldn't say I'm a religious person. My father is though. He's a Jehovah's Witness. So when he tried to contact me in life, a lot of the time it is about religion. So
Mhm.
that whole background with my father kind of like shunned me out from religion. But moving to the South has changed my point of view on that a lot. I wouldn't say
Mhm.
I'm a now, but I believe more.
Mhm. That's good to hear. I love that you kind of want to form your own relationship with being in a religion. That's good to hear. Let's talk about your kind of like strengths. What would you say are some of your strengths?
Me personally, I would say I'm a dependable person. I feel like if anyone needs something, a lot of my friends know they can come to me
Mhm.
in terms of advice and all that stuff. I'm a hard worker. I pick up on things very easily.
Mhm.
I feel like if you need a job done, I'm the guy you can call. But at the same time, I'm not gonna do it alone. I feel like I work better in a group.
Mhm.
More, I feel like I have my own strength by myself, but I have a lot more potential in a group.
That's good to hear. Um, at any point, have you ever thought about harming yourself?
As a kid, it was very weird. It wasn't self-harm, it was seeing how much pain I can endure. I have a very vivid memory of me running into a metal basketball hoop, knee first, just to see what would happen.
Mhm.
In terms of like self-harm now, no, not at all really. I have a better understanding of it now than I did as a kid.
Mhm.
Um, but no, there no thoughts of self-harm now. Mm-mm.
Okay. Just wanted to see how your strength
Yeah.
was when you were a kid. Okay, good. That's good to hear. That's a funny story. Um, we're gonna end off with just discussing what your kind of goals are with possibly enrolling or attending therapy, or what your goals are, if you see that maybe therapy just isn't for you. What sort of goals do you have and motivation do you have to kind of help you with your anxiety and like your Hispanic cultural background?
Mm. Like I said, like growing up in Hispanic, therapy was also frowned upon because if there's a problem, usually family wants to deal with it internally.
Mhm.
Now that I'm older and I been away from my family, like living on my own, I feel like therapy is the need and is very like it does wonders from what I hear and what I can see from other people. Because a lot of my friends do attend therapy as well, and
Mhm.
they're on my mind a while now. It was just hard to like I guess I don't know what the word I'm looking for, but like actually accept it. That I need help from a professional.
Mhm.
Now once I do get my card, therapy again it's another thing I'm definitely gonna look into for me just to be able to feel better about myself.
Mhm. So your main goal right after you get a car will possibly
Mhm.
be enrolling into get doing therapy.
Yes, ma'am.
Do you have any aside from possibly going to therapy, um, what would kind of be your some other goals that you would like to set for yourself? Maybe like financially or just with your job possibly or with school? What sort of goals do you have in those areas?
Definitely, I want to go back to school and re-enter the psychology field for my job specifically. I had completed a semester of psychology, and I feel like I passed with A's and like good grades basically, and it was
Mhm.
fun for me going back to school and learning more about the thing I love, which is psychology. It was hard because once I moved to Michigan for my girlfriend's pregnancy and all that, I had to, I guess, drop school and just focus on her and the pregnancy.
Mhm.
And that kind of came back to bite me because now I owe Chattanooga some money before I can enroll again. So definitely financially, I want to be able to save up money so I can pay the school back and I can enroll again. And I feel like once I am in therapy and in school, I will be so busy that I
Mhm.
don't have time to like deal with the anxiety, I guess you could say.
Mhm.
Yeah, definitely going back to school is a motivator and really going back to school is so I can get my degree and start a career in psychology so I can set up my future, not only my future, but my kid and my girlfriend's future.
It's good to hear. I'm just gonna look over some other questions that we could probably ask you. Um, is there anything else that you maybe want to discuss um today aside
No,
from what we've kind of already gone over?
no, not really. I feel like we covered a good bit of it.
Okay. Well, it was really nice meeting you. We're obviously gonna look over all of the information that you've provided us for us today, and see what sort of help we can provide you with.
All right, that sounds good. Thank you so much for
Mhm.
having
It was nice meeting you. Have a good day.
me as well.